Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch title is A Prescription for Patient Payments to Reduce Your Receivables. We're joined today by David Crooks, the President of EasyPay Solutions, a Chicago-based company focused on helping healthcare providers expedite patient payments while reducing bad debts and patient receivables. Mr. Crooks was previously the Director of Healthcare Marketing for Visa, and he has more than 20 years of experience in electronic banking and healthcare networks. We are honored to share his expertise with you today. Thank you for joining us today, Mr. Crooks.
Thank you.
All right, I'm going to go over some quick housekeeping notes with our attendees before we begin, but please, out there in the audience, if you just want to look at the questions we're going to address today, while you look those over, remember that you can ask questions of our presenter at any time during today's session by entering them into the chat area. In the second half of our presentation, we'll address as many questions as time allows. If we do run out of time, answers to all of your submitted questions will be posted to our website and sent via email link later in the week. Also, remember that all registered attendees of today's session will receive an email with links to both the slides and the recorded version of the event. So we've already had a member of our audience ask if they can get the recording of this session. Everyone out there, rest assured that we'll send those out after the event so you can review it or share it with your colleagues. All right, well, let's dive right in. We've got plenty to cover here today, and this is a very important topic for healthcare today. So, Mr. Crooks, why do providers have such a hard time collecting from patients?
Well, that's a very good question, and it's frequently asked. The truth is that providers are really struggling with consumer payment habits. And the bad news is providers are in last place. Your patients think the doctor is rolling in cash based on their perceived lifestyle, big houses in the best part of town, fancy cars, and kids in private schools or Ivy League colleges, memberships in the local golf club. As such, the doctor doesn't need timely payment. You and I know that's far from truth. But according to Visa's research, it's reality to your patients. Every 2 years, Visa, the credit card company, does an extensive consumer research panel. And since the healthcare industry is important to them, they've done a lot of in-depth consumer research on patient payments. And I'm going to be referring to this several times in today's presentation. Before we go to the next slide, I'd like each of you to take a minute and just think about how you pay your bills. What are your priorities? What's the first thing you pay every month? And then what's the second and the third? And what's the last thing you pay? Or if you don't have enough money in the bank, what are the things that you typically put off? All right, let's look and see what Visa's research shows.
So what are the actual results? How do Americans actually pay their bills?
Well, they first make their house payment or their apartment rent. Then they pay the car. They don't want to lose their mobility. Then they pay the utilities. Can't go without cable TV. Then they pay their bank and credit cards because that represents entertainment a lot of times and also for emergencies. Then the food, the gas, the clothing, the kids, the vacation, the new car, and if there's money left over, the doctor, the dentist, and the hospital. Providers are in absolute dead last place in the way Americans pay their bills. That means if there's extra money in the budget this month, you might get paid. Notice that entertainment, vacation, and a new car come before paying the doctor. So your problem in collecting from patients is the patient's paying habits. And that's hard to change.
So obviously that's a huge problem for physicians. Is this something that you think is going to improve in the near term?
Very doubtful. given that Obamacare is shifting more of the patient responsibility to patients through high deductible plans, that means the patient's going to have more out of pocket to pay the doctor. On top of that, the economy is still a big problem for most people, and unemployment remains at high levels. I live in Chicago, and unemployment in Illinois is 8.4%. And finally, you've got a country that has a bad habit of not paying doctors promptly. And to make matters worse, Visa research shows that patients believe the doctors are already well compensated by the payer payment and the co-payment. So there's no hurry to pay them. The survey also showed that 15% of patients have no intention of ever paying the doctor any more than a co-payment. At least 85% of your patients have some intention of eventually paying you. So you're never going to collect from the 15%, no matter how many phone calls or statements you send them. Wouldn't it be nice if you could determine who they were before you provided the services? I'll tell you how to identify them shortly.
Well, those figures amaze me. We were chatting before the session began, and the 15% who never intend to pay, I'm amazed that it's that high. But you can see through the information you've shared here how even those who do intend to pay, there's some education that needs to be done and kind of some problems that we can get into more detail about how to address that. So here's a cartoon we're sharing with you.
Well, this cartoon is meant to be funny. More often than not, it's reality. As you well know, when it comes to patients paying their doctor's bills, there's a definite shortness of cash.
So what are some techniques that you see providers using to try to collect patient payments?
We see 6 techniques and methods that have been used. The first method I call more of the same, and it produces diminishing results. More calls and more dunning notices don't really produce more cash. That's, again, because of the Visa paying habit study and the consumer perceptions of rich doctors who don't really need the money. I just saw a study by a company called TalkSoft, which showed that 75% of collection calls go to voicemail, which means that 75% of your telephone efforts are wasted. The second one would be writing it off as bad debts and taking the tax loss. That's pretty painful. Research by the Commercial Law League of America shows that patient receivables after 3 months are only 73% collectible, and after 5 months only 28% collectible. So if you don't get your payment from patients quickly, the odds against you collecting it are not good. Some doctors have hired collection agencies, usually where they know the patient has the capacity to pay. However, there is a real danger of word getting around town that the provider uses aggressive collection tactics. Merely informing the credit reporting agency that a patient is in arrears accomplishes virtually nothing these days, because lenders don't penalize patients for past due health care receivables. You can buy a house or a car and get a bank loan with past due health care receivables on your credit record. Another problem with collection agencies is that doctors typically don't turn over past due receivables to them until the receivables are 6 months old. That's, of course, when there's virtually no chance of collecting them. The Commercial Law League of America says there's only a 12% chance of collecting 6-month past due receivables. There are several affluent counties in New York State where the local medical association has gotten together and all the providers have agreed not to accept insurance. As such, it's payment in full at time of service. The providers estimate the total fee and provide the patient with the completed forms to send their insurance companies. Obviously, this technique only works if all the providers in a given specialty or in a given geographic area agree to this technique. Otherwise, patients will quickly find a new doctor. We've seen some providers who collect a large deposit at the time of service. This violates some of the payer contracts, and there are some states that prohibit this practice. The biggest problem with this technique is that you can never estimate the payment amount exactly. So you're either billing the patient, for an additional small amount, or carrying a credit balance for their next visit. The best technique we've seen is to get the patient's credit or debit card at the time of service and keep a signature on file that you can use to process a payment when the final patient payment amount can be determined. This puts you in control of when you get paid. It also eliminates billing and collection and the possibility of a bad debt. The patient is going to know what you owe them from the EOB that they get from the payer, and you can easily email them a credit or debit card receipt on the day you process that final payment. I know what you're thinking. How will patients like this approach?
All right. Well, how do patients react to these different techniques?
Well, some of them react like the woman in the picture. Ah! But if you just send more of the same, patients ignore you. They don't even open the bill typically. So you're wasting your time and effort. If you turn patients over to a collection agency, they won't be happy, and they'll probably tell their neighbors, but it won't really affect their credit rating. And with no pain, there's likely to be no payment. Patients get really happy when you write their past due balances off the bad debts. It's kind of like a get-out-of-jail-free card in the game of Monopoly. Of course, they never know when you've written it off. They just know that you stopped calling and sending dunning notices. If you refuse to accept insurance and require full payment at the time of service, it's probably going to be the last time you ever see that patient, unless, as I said previously, all the other doctors in the area are doing the same thing. They will panic when you ask them for more than a copay. I'm sure you've seen that many, many times. They will also panic if you ask them for a large deposit at the time of service. Go to the next slide.
Yeah, so those reactions are obviously not what you want to see from patients. When it comes to keeping signatures on file, how is that a little bit different then?
Well, many providers have had great success with getting credit card and debit card signatures on file at the time of service. Patients will generally go along with this approach if you warn them in advance, such as sending out a letter explaining the change and why it's necessary. Those patients with no intention of paying you, the 15% in the Visa study, will go elsewhere, which you should rejoice over. Not only are you going to save the wasted time in providing services to the patient, but you're going to save the billing and collection expense as well. So it's how you introduce the program of credit card and debit card signatures on file. We're going to talk about that just a little bit later. Some more humor. Unfortunately, attitudes like you see in this cartoon have become prevalent. If I had to guess, I would bet that more than half of your patients don't open up their statements when they arrive and only look at them after a few collection calls or dunning notices.
So what about patient retention then? Is this something that could cause patients to go elsewhere?
Well, this was a really surprising part of the Visa consumer research. It showed that patients who owe money frequently go elsewhere, where patients that are paid up come back to their doctor. And the study asked why, and the answer was because patients are afraid that they're going to be asked to pay the past due balance when they return to the doctor's office. They're also concerned that somebody they know might be sitting in the lobby and overhear that conversation. And some feared that they were no longer creditworthy in the eyes of the provider. So not only were they going to be asked to pay the past due amount, but they would also be asked to pay an estimated amount for today's service. It's in effect a double payment. So patients can easily avoid these perceived fears by going to a different doctor. So if your practice is suffering attrition, this may be the reason. Keep your patients paid up, and you keep your patients.
So I think there must be many questions about doing a signature on file program out there. Is this something that's going to disrupt the office workflow and how billing works currently?
It's actually going to expedite the workflow because you're going to be making significantly fewer collection calls and sending out a lot less dunning notices. And if you decide not to mail zero balance statements after you process these credit cards on file, you'll also save all the time it takes to produce and mail the statements, or the expense if you're outsourcing that. Another advantage is you won't have all those checks to deal with anymore. No more lunchtime trips to the bank for deposits. And you won't have to chase patients because of bounce checks, and I'm sure that's not your favorite sport. Some practice management vendors offer an automated posting of credit and debit card transactions to the patient ledger. So unlike checks, you don't even have to manually post the payments. Even if you did have to manually post the credit card payments, that's going to require a lot less effort than making collection calls and sending out dunning notices and waiting month after month to get paid. Best of all, you choose when you want to process these signatures on file. You can fit the payment process into any part of your day or week. It doesn't have to be done at a particular time.
So you talked before about patients that already owe money. What are the best ways to collect from them?
I've discovered a simple four-step process to collect past due amounts from patients with the capacity to pay. The only hard part of this is getting the patient on the phone. As I mentioned earlier, the recent study that showed that 75% of collection calls go to voicemail. That's your enemy. But once you get them on the phone, you can pretty quickly figure out if you're going to get paid, and most importantly, how. And this is the four-step process. Start by setting up an office policy for large past due amounts. If an amount is due, say they owe you $500, then the patient will be offered a payment plan, perhaps $100 a month. Once you've got your policy in place, call each patient that's past due and come right to the point. Okay, hello, Mrs. Jones, this is your doctor. How are you today? Can you bring a check for $500 to our office today to bring your balance current? Expect that the patient's going to make an excuse as to why they can't pay you. The dog chewed up the checkbook. I don't have any money. I don't get paid until Friday. You say, I understand. If you'll just give me your credit card number, then I won't have to call you again. And you enter it into the credit card software or your credit card terminal, and you're paid. If you're offering the extended payment plan to this patient, you'd say, I understand. If you'll just give me your credit card number, I'll spread the $500 you owe over 5 months. That means we'll only charge your credit card $100 a month, and I won't have to call you again. So you always want to get that, won't have to call you again. That's the pain to the patient. So you set up a recurring payment in your credit card software. The next step would be if the patient won't give you their credit card information. Then you've got to ask them directly, do you intend to pay us the $500 that you owe? If they say no, end the call and turn it over to collection policy or your collection agency or write it off to bad debt. If they say yes, ask them when and how. If they say they'll pay you in 2 weeks, ask them again for their credit or debit card number and tell them you won't process the payment for 2 weeks. And typically you would set that up as a one-time recurring payment in your credit card software with a start date 2 weeks from now. As I noted above, the hardest part of this process is getting the patient on the phone. But once you do, you will quickly find out if they are part of the 15% in the Visa research that have no intention of ever paying you, or if they're in the 85% that eventually plan to pay you. If they don't intend to pay you, if they do intend to pay you, be sure on that telephone call you lock them in with a credit or debit card payment plan. Don't accept, I'll send you a check. Tell them you only accept checks at the time of service. promise to send a check in the mail is rarely kept, and post-dated checks are like a rubber ball. They almost always bounce.
Those are great points. Before we move on, I just want to remind our audience that you can ask questions of Mr. Crooks at any time. We've already got some questions from our audience. We're going to save those till the end of the session, but please do feel free to ask those now. And just to remind you, we will be emailing all of our attendees the slides and a recorded version of this session. So how do providers get the front office staff motivated to ask for signatures on file? This is going to be a little different for them. What are some tips on that?
Well, our experience is that if you offer the front desk staff $1 for each signature on file that they get from patients for some limited period of time, you'll get 100% of the patients to give you a signature on file. Now, that's the ones with an intention to pay you. Of course, the 15% with no intention of paying you are not going to go along with that. There's a huge savings in money here because you just lowered the collection cost from what was $30 to $50 per patient, per past due patient, to just $1 plus the credit card fee. And you've also eliminated a lot of effort for the administrative staff. They're not going to have to make all those collection calls, and they're not going to have to send all those dunning notices. Many doctors are so happy with the results that they've made the $1 spiff for getting a signature on file a permanent part of the front desk person's compensation plan. And they're laughing all the way to the bank.
So how quickly could a provider implement some program like this, a signature on file?
You know, a realistic expectation is it should take about a month to do this. The most time-consuming part of it is sending out a letter to all the patients explaining that you've been faced with rising costs and you either have to increase your fees or eliminate some expenses. And a short survey of patients unanimously said to eliminate expenses. So you did. And you eliminated billing and collection. As such, the next time patients come into the practice, they will be asked for a credit or debit card, which we kept securely on file until what they owe is finally determined after claim adjudication. At that time, their payment card is going to be charged. And we've seen letters that follow this script be wildly successful. You will want to be sure to train your front office staff to say, you know, to patients, to remind them when they come in that they're going to have to provide a credit card on file, and you're going to have to know what to tell new patients that call on the phone for an appointment. Yes, there's going to be special cases, but think if you could get 95% of your patients using signatures on file, billing, collection, and bad debts are going to virtually disappear. There's going to be a lot less stress in the office, and the doctor's going to be really happy on Friday afternoons when he or she asks, how much money do we have in the bank? If you don't start using signatures on file for your patients, you might have to resort to some desperate measures to collect from patients, as we see in this cartoon.
So this is probably a less successful strategy for collecting patient payments.
Yeah.
So you talked before about kind of the low success many providers have in collecting these payments. What's a realistic expectation if they implement a signature on file system for reducing those patient receivables?
A conservative expectation would be a 10% reduction in 90 days, 50% in 180 days, and 80% over the course of a year. However, we've had doctors that reduce patient receivables as much as 50% in 90 days. So if you can get your patients on the phone and collect those past dues, you'll dramatically reduce your receivables. Because remember, you're not adding new receivables. Because as soon as you know what a patient owes, you're paid. So what you're doing is working down what's currently owed. You're not replacing it with new receivables. So, and all this reduction is going to go straight to the provider's bank account, as you can imagine. And they're going to be very happy. If I was a practice manager, I would want to be on a bonus plan. Certainly there are variations for the types of practices, and such as, let's say, a geriatric practice or an in-hospital practice, where and especially where patients don't have the ability to pay their medical debts. The important thing to remember about a signature on file program is that it puts you in control of when you get paid by patients, instead of waiting for patients to have a month with extra money when they can get to the bottom of the pile of their bills. Remember, you're last.
So what is all of this then going to be? What impact is this going to have on the office staff?
Well, I know the office staff is going to hate to quit dialing for dollars at dinner time, and they're going to really miss those stressful times when the provider wants to collect some extra money for his or her vacation or the kid's tuition payment. Practice managers are going to benefit from a lot less stress in the office, and they're going to have a lot more resources now to collect from payers. So the practice gets the double win: faster patient payments and faster payer payments, because you now have the resources to respond more rapidly to documentation requests and rejected claims from payers. The bottom line is less stress and higher collections, and that should keep your providers really happy. In closing,
go ahead.
I urge you to consider today's discussion in light of your practice and patients. Efficient and timely collection of patients may mean survival in the difficult world of Obamacare, and will become even more important as time goes on. Remember the enemy: consumer paying habits. You have to find a way to get out of last place. And now we'll take some questions.
All right, well, we've saved plenty of time for questions, and we already have a number of questions from our audience, but if you've been holding your question, please do type it into the chat area, and we'll share it with our presenter. The first question, this is great, is sort of to emphasize what you were discussing earlier in this session, which is this person would like you to repeat the percentage of payment after 90 days. And then they say this, they're asking about the site you referenced on those overdue payments.
I think it was the Commercial Law League of America that the statistics came about. I presume they're referring to the collectability of,
I believe so.
Receivables. Yeah. That was from the Commercial Law League of America.
And what was that percentage again? Do you have those numbers handy?
73% collectible after 90 days, 28% collectible after 5 months, and goes down to 12% after 6 months, which I pointed out was the point where most providers pass the receivables to collection agencies. So they have very little chance of collecting.
Yeah, by then it's really too late, but it takes very little time for the percentage to be mediocre at best, and it just plunges in very little time after that. Let's go to another question.
Correct.
So how will the program know what patients to charge and what credit cards to use? How does that work?
Well, there's a number of ways to do this. Some practice management software companies automate the process so that when you call up the patient record, you're posting the EOB, or if you've posted them electronically, you're looking at the record, and it shows the patient has a balance remaining. There's an indicator on there. Some practice management vendors use a little credit card symbol, and you just click on that, and it automatically goes out, gets the authorization, and then posts the payment to the patient ledger so that there's now a zero balance owing. Manually, if you don't have that capability in your practice management software, what you would do is after you post the EOB and you're reviewing the patient balances, you could input an indicator when you get a credit card on file, or most providers presume they have one. And what they do at that point is they click the icon for their credit card software, call up by usually patient ID or patient name, the signature on file, enter an amount, it goes out, authorizes, and come back and post the balance, something that takes maybe 20 to 30 seconds. So there's really two ways of doing it: automation and then doing it manually. But even the manual process is typically 20 to 30 seconds, which is about the amount of time if you were posting a check, calling up the patient record, entering the amount, and bringing it to a zero balance.
One of our attendees would like to know whether you could provide a sample letter, I assume in the follow-up, or you could write them directly, a sample letter that would help them understand how to communicate this to patients.
I would be delighted to. In fact, we have a professionally written letter that we can make available to present the fact that the provider is, faced with increasing costs and either was going to have to increase fees or eliminate some expenses. And it's been very well received. We have tweaked it from time to time. Providers put it on their own letterhead when they send it out, and it's been generally well received. And we've been told that about 80% of patients don't have a problem with providing their credit card or debit card on file to their provider. Most patients have had a long-term relationship with the provider, and most patients also know that providers are under the HIPAA security rules, and that their information that's stored there is pretty secure.
Well, and as you were saying before, it makes sense that those patients who are willing to pay, those who are in the 85%, for them it's actually a convenience measure. It keeps them from being bugged and having to remember to pay the bill and getting called and all of the things that you mentioned before. And the 15%, if you were to lose them over it, those are probably people that you're better off not having in the practice anyway.
In fact, I have a dermatologist in the Chicago suburbs, and he does a high five with his office manager when a patient walks out and refuses to provide a debit or credit card, because he says that's bad debt walking out my door. And he has a list of the other providers in his specialty that he gives to patients if they don't want to provide a credit card on file. And you might be happier at one of these other providers that is located nearby. And so he does refer them to his competition. Yeah, only he knows that it's bad debt walking out the door.
Right.
But he quite enjoys that, and he's had tremendous success with a signature on file program. In fact, he's got 99% of his patients on it, and he rarely ever has a collection problem. Another little twist that I've seen used is some people with these signatures on file will send out a letter, an invoice to a patient saying, if we don't receive your payment in 2 weeks or 4 weeks, then we're going to use the credit card that you have on file with us to process a payment. So it gives them a chance to write a check if they want to. The reality is that I've been told that nobody writes checks. They all just wait till the 30 days is up or the 2 weeks is up and let the credit card payment happen.
But that's an interesting way of framing it, because you're sort of giving them a way of opting out, but I'm sure it's not surprising that most people just let you go ahead and do the charge then.
And that might be another way to implement the program, where you're going to tell the patients that you have a chance, okay, to pay your bill in a timely fashion. If you don't, then we're going to use the signature on file. Over time, I think providers will realize that there's no point in sending out those statements because nobody's paying them. So you might as well just go right ahead and go to the signature on file. And that might require a second letter if you change your policy that way. One other thing I haven't mentioned is there's several kinds, under the Visa, MasterCard, Discover, Amex rules, there's several kinds of legal signatures on file. You can have one that is good for one visit, or you can have one that's good for all visits during the course of a year, including family members. So just in terms of the effort to get these signatures on file, it's much easier to get an annual signature on file so that you don't even have to ask the patient when they come in for the copayment. You just use the signature on file, as well as when the final determination of is made after adjudication, if there's a balance owing, you just use the signature on file. So you're always paid at the soonest possible moment.
Well, those comments feed into our next question, and I know that EasyPay has a signature on file program, so you can speak with experience on this. There's several questions about the legal aspects of it, and so one of them is, if you call patients on the phone to charge their credit or debit card, legally, how can you support that charge?
Well, now you're into you're talking about a collection call, not a signature on file. Let's differentiate between the two. So I've called the patient and I've said, Mrs. Jones, you owe us X amount. Can you give us your credit card, and we'll just take care of that right now, and I won't have to call you back. And so Mrs. Jones provides that credit card information. Very unlikely she's going to do a chargeback. And if there was a chargeback, how in the world would the provider have ever gotten the credit card information if Mrs. Jones hadn't provided it? That's how you would defend that. She called me and gave me a credit card number. And that's the only way I would possibly have her credit card information. So I don't think that's a problem. Chargebacks are not a big problem in healthcare. People usually have a long-term relationship with their provider. And the place that we do see some chargebacks, though, is where the doctor has a policy where there's a $50 fine or fee for failure to cancel an appointment. And, a lot of patients will say, just like a hotel room, you call and cancel it, and then you see the charge on your credit card bill. And a lot of patients will challenge that and say, I called in, I spoke to Martha, I told her I couldn't make that appointment. So, or, it was a case of they had to go out of town, somebody in the family died. I wasn't even thinking about it. Anyway, that's the places that we typically see chargebacks. So there's not really a legality issue with taking a phone number, taking a credit card over the phone.
Well, this then feeds into a question about the PCI DSS. So for people who may not know, PCI is the Payment Card Industry Data Security Standard. And I think this has been a good segue for you to talk about how EasyPay's system works, because the question is, do you think medical offices are PCI compliant? And so to unpack that question, it's, would it work in such a way, is the medical office going to keep this vast file of all these different credit card numbers and signatures, or how would this work in practical terms for how they can keep these signatures on file without totally violating the customer's security?
Excellent point. EasyPay is a PCI level 1 processor. That's the highest level of security that you can have under the PCI guidelines. PCI is like HIPAA, okay, but it's specific to the banking industry. And the answer is that PCI says if you touch, transmit, or store credit card data, then you have to, go through this PCI certification process. The way EasyPay works is that we propagate the screen where you put the credit card information in. So you, the office, is not touching the credit card information. Okay? We transmit it to our web portal, and we store it. So you aren't breaking any of the 3 PCI compliance rules. You're not touching, transmitting, or storing credit card data. If you recall it, we only show you the last 4 digits of the card number. Again, to keep you, the provider, PCI compliant. So there's no information in your office, but you can get on your computer and get whatever you need very quickly. I can't speak to how others do it, but that's the way we do it. We, in effect, insulate the practice from the major requirements of PCI. Yes, PCI requires that there's a quarterly scan, external scan, to make sure there are no open ports on the provider's computer, but so does HIPAA. So you meet that requirement typically through just being HIPAA compliant.
So it really cuts the provider as much as possible out of the process of maintaining this credit card data.
Correct. And it insulates them from the PCI audit rules.
Here we have a question about, how widely can software like this be used? Is this something that can integrate with billing software? Does it need to integrate? Can any practice adopt this?
The answer is yes. Any practice can use it. It can be integrated with the billing software, but the billing software company needs to do that. It can't be done at the provider's office. And it can be used anywhere in the 50 United States. Okay, the visa rules outside of the U.S. are different than the visa rules in the U.S. The software is completely compliant with the visa rules in the U.S. The reality is, when I worked at Visa for 6 years and ran healthcare, I wrote the rules. So I know it's compliant. And there are a lot of rules about what has to be on that signature on file form. And we actually produce that in such a way that is totally compliant with all the Visa, MasterCard, Amex, and Discover rules. And we limit the length of the signature on file to 1 year, which again is a part of the rule that Visa has and MasterCard, that a signature on file in a healthcare office can only endure for 1 year.
And so when that year is up, then, is there a process whereby the provider needs to get reauthorization from the patient?
Yes, they need to get a new form, and offices handle that different way. Some, still use the folder with a lot of the patient's notes in it, and they just write the date. They'll write like EasyPay and the date of renewal. So when they check in at the front desk, they can easily see that they need to get a new authorization. Another way is that some providers just do it visit by visit. So it never expires then. Each time they come in, they get a new one. Some providers have mentioned to me, well, what if the card expires in less than a year, and you're trying to do a signature on file for a year? Well, the software edits that, and they'll give you a warning message. So you can't do a signature on file for a period beyond the expiration of the card.
And so when you're talking about signatures, are these literally signatures, or is that kind of a metaphor for the patient's authorization?
It's literally a signature. And in the event of a chargeback, where a patient challenges a charge related to that service, here's this piece of paper. It says, I authorize Dr. Smith to keep my signature on file and charge my credit card for up to, and they put in a maximum amount for the balance owing after claim adjudication. Or if it's an annual, again, there's a maximum that is denoted. Now, you can set a maximum that is, I'm talking about our product. You can set a maximum as a default. So if you know that 98% of your patients owe $200 or less after adjudication, you can just make that the default. But if it's a new patient, or a patient is going to receive, say, some in-office surgery, and it may exceed the 200, you can just override it for that particular office visit.
So it sounds like there's a lot of customization that can be done. Can providers use this even if they don't want to integrate it with their billing software? Can it just be sort of a standalone, I don't know what to describe it as, but it's just the portal itself?
Yes, absolutely. It functions both as a standalone, and it functions as a integration into a practice management software product. We don't have all the practice management software products lined up yet, but we're working on it to offer more automation. And but yes, very much standalone. We have lots and lots and lots of doctors that are standalone. That means it's not, the credit card module is not connected directly to the practice management software. And it replaces the terminal. It does everything the terminal will do, in addition to the one-time signatures on file, the annual signatures on file, and the recurring payments, such as payment plans. Does all of that. But if it's just a simple $20 copayment, it can process that as well. Produces the receipts, just like a credit card terminal would.
So you mentioned before, the next question from our audience is about sort of different patient populations, you could call it. And the question is just, do different patients have different reactions to this program?
Yes, clearly. We've noticed that older patients, and I say older, let's say above 70, they typically use credit cards, going back to consumer paying habits of Visa. They typically use credit cards only for emergencies or when booking travel. And they don't want to use a credit card at a doctor's office. And most of them don't have a debit card, or if they do, it's only an ATM card, and they've only ever used it at an ATM. So again, that's a difficult population to address. We have a hospital in rural Colorado that uses EasyPay, and many of their patients are farm laborers, and they don't have credit cards. So obviously, they can't get a signature on file from them. So if you look at the population with the capacity to pay and the population with a credit card, that's where EasyPay shines.
Can people use a checking account number and routing number in this system, or is it only for credit cards and debit cards?
The answer is no. They can't use a checking number, a checking account, or and a routing number, which we typically call an ACH, or automated clearinghouse transaction, in EasyPay. We thought about putting that in, but there are some rules that we would have to change the software in order to make it in compliance with. And I won't say we won't do it in the future, but at this point in time, the answer is no, we don't do that.
Well, and I have to say that I think for many patients, personally, I rarely use checks at all anymore. My checkbook is almost forgotten because there's no need for me to use it in the vast majority of cases. And so being able to use a debit card or credit card is good enough. I suppose it might be advantageous for patients that you were just talking about who may not be as comfortable with the plastic, I guess you could say.
I think the only place that ACH might be appropriate is if the patient is on a portal registering at home where they have their checking account number. They can put it in there as an alternative to a credit or debit card number. If they preferred to use their checking number, again, maybe that would appeal more to an elderly patient during the patient registration process. I don't think most people carry a checkbook, as you said, into the doctor's office. So
I certainly don't.
They've just got plastic.
So here's a question that I think is kind of an interesting one. Is there anything that doctors can do to identify patients who won't pay before the visit? And I suppose the example you gave of the dermatologist is one answer to that. I'll let you.
Basically, asking for a credit or debit card. If they have no intention of paying you, they're not going to give you that card number. And this applies to not only when they're in the office, but also when a new patient is calling to register. Remember, that new patient might very well be coming to your practice because they owe money at another practice. and they don't want to deal with being past due or the embarrassment of somebody seeing them discussing this with the office manager. So if you tell them you're going to need a credit or debit card on file, and they hang up on you, it's a patient with no intention of paying you. Now, exception if it's a really elderly patient, okay? That might be a little different. As I said, there's going to be 5% that are exceptions. But for most part, patients that will not give you a debit or credit card are patients that are in the 15% that have no intention of paying you.
So some of this, there must be some messaging that I assume that you're able to help providers with, in the sense that you were saying now that when you sort of give the patient advance notice that they need to bring a debit or credit card with them, and then I assume that there's some messaging that happens in the office as well. You talked about the front office script, for example.
Well, we have a script in the software which the user can actually change, so they can make it customized to their practice, and they can print that out. So if they want to print it out and paste it down on the countertop, or they want to look at it on the screen, they can do that too. But they memorize it really quickly. Our experience is that if you provide that financial incentive, even for a limited time to the front office staff, they will become expert at that script and discussing this with patients really fast. I'm talking about like in less than a day. They learn really fast when there's money dangling out in front of them.
So here's a question that may be beyond any of our ability to answer, but given your experience, I think you're the best source on this. Why don't lenders penalize patients for the overdue patient bills? You said before that that tends not to affect credit. Why is that the case?
You know, I don't understand that. I think it's largely because healthcare crises are unplanned. Nobody plans to have a heart attack and need major surgery. And I think that it is because of that reason, or have a child that has a disease or some serious health problems. And as such, that can many times put people in a really precarious financial position. And I think that is the reason why, banks and lenders don't look at healthcare past due receivables as they do at other debts.
So what about patients then who sign up for the system, everything seems good? What if they then dispute the payment once it's processed?
Well, Visa has a set of chargeback rules, but if they do, generally they're going to call the practice and discuss it with the practice. Remember, unlike, say, a retail merchant where you walk in once in your life and buy a shirt or something and doesn't meet your requirements, you have an ongoing relationship with your healthcare provider. So that patients will generally dispute with the provider office as opposed to calling the bank and doing a chargeback. One of the things that we found that really reduces the chance of them calling the bank is that, on the credit card statement where you see the list of all the merchants and the dollar amount related to that, if you put the practice phone number after the merchant name, okay, in the bank setup, so that when the patient's looking at the bill and they see Dr. Smith, there is the phone number. If they have a question about the amount on their credit card bill, it's easier just to call that number than it is to turn it over, read through all the fine print on the back of the statement, and try and find the number to call the bank and dispute it. So generally, patients don't dispute them with the bank. They dispute them with the provider. In the event they don't get satisfaction with the provider, yes, then they could potentially dispute it with the bank. What does the bank do? The bank is going to ask for a copy of the signature on file form, and if it meets all the Visa MasterCard requirements, provider is going to win every time.
So what should the expectation of providers be around cost for a service like this? How does that part of it work?
There is no cost for the service other than the credit card fee, which they're already paying for credit card transactions. And, companies like ours are no higher than anybody else. I think you'll find that almost all credit card companies are virtually, because the competitive pressures are virtually the same. So, we don't charge a premium for people using our software. The software, access to the portal is free. There's no charge. There's no application fee. There's no training fee.
That's remarkable.
Pay as you process credit card transactions.
So essentially, the provider would, substitute this service for whatever credit card processing they're using at the current time, and that's it then.
That's it. Exactly correct.
All right. Well,
and think of the savings. Think if you could reduce your receivables 80% and eliminate bad debts, and make the office a lot more efficient for what you're already paying.
Yeah, so we have time maybe for one more question. We didn't get to quite all the questions. We got to almost all of them. This question is, so the office workflow, by streamlining that, then does that allow you to collect those old payments? What do you do then with the streamlined workflow?
Well, typically, remember the past due payments. When you finally can contact every patient, you're going to know, yes, they can pay, and you have, a payment plan, in effect, a credit card transaction in the computer, either all of it right now or spread over some period of time, or they're not going to pay. So whoever's doing the collection calls right now, their job's in effect going to go away calling patients, and they can use their time and efforts to call payers or provide information to payers that have rejected claims or asked for more documentation. So it's kind of a shift, but in the short term, that collector is going to need to call all the past due patients. But once you've got a hold of all those patients, you're only going to have one call to each patient. You're either going to get the information and get it into the computer and have a definite payment plan on a card, or you're going to write it off as bad debt or give it to a collection agency, one of the two.
So there will always be plenty of time required to deal with the insurance companies, and that will give you more time to deal with that ongoing situation.
Well, the difference is this. If you jump through all the hoops with the insurance company or payer, you're going to get paid. But if you jump through all the hoops with the patient, frequently you're not going to get paid.
Right.
Even though you've sent them reminders and you've called them and everything else. And what are they going to do? They're just going to go to another doctor the next time. So you've lost the patient, you've lost the money that you provided for the service, you've lost all that collection and billing expense. You're the big loser. So you've got to arrange firm payment arrangements at the time of service. That's the only way practices are going to survive under Obamacare.
Well, I want to remind our audience that we're going to take all of your questions and pass them on to our presenter. He'll be happy to take those questions and provide you with written answers. And if you've asked for resources, I'm sure that Mr. Crooks will provide those as well. We're going to send out some follow-up emails. They'll provide those resources and that information to you. I want to thank you for joining us, Mr. Crooks. The service you've talked about, EasyPay, our attendees, if they're interested in learning more, they can go to www.patienteasypay.com. Can you tell us just a little bit about what they'll find there in terms of resources?
They're going to see a quick overview of 4 or 5 pages as to what are the benefits to the provider, a little bit about how does it work, and a phone number they can call to ask more specific questions, or if they want to get started and sign up and try it. All of that information is there.
So if they go to www.patienteasypay.com, they can learn more and also contact EasyPay to answer any follow-up questions they may have. And we'd be happy, if you contact us at Format Approved, we'd be happy to put you in touch with the folks at EasyPay as well. Thank you so much for joining us today, Mr. Crooks. This is a great session. I know that this is an area where lots of providers are looking for help, and I'm sure that most of our audience had no idea that this was even an option.
It's been entirely my pleasure, and a large part of our mission is education, to help providers get paid by patients. We have a passion for that. That's the only thing we do.
Well, whether you go with EasyPay or another service, I think this is a great option that people should explore. So definitely education well worth sharing with our audience. Thank you very much.
Thank you.
If you need training in credit card security, you can visit www.formedtraining.com. As Mr. Crooks mentioned, PCI DSS does have a number of requirements. You can learn about that program and get certified in PCI DSS security by taking our course. Go to that website, click on the HIPAA and compliance category, and choose the Certified PCI DSS Professional course. Visit formatapproved.com to learn more about our upcoming Learning Lunches. The Learning Lunch button will take you to our upcoming webinars where you can learn more and register for those events. Our next Learning Lunch will air May 20th and has the title, How to Win the ICD-10 Game. ICD-10 may have been delayed for a year, but it's certainly not going away. So if you're a practice manager or someone with responsibility for that area, there is certainly much to learn. Keep an eye on your email box on our homepage for other upcoming topics, and do look for that follow-up to today's presentation. Thank you again for joining us today.